my my shoulder were inclined, and he worked on that so hard. Okay, Alhamdulillah, I feel like 70%, Alhamdulillah.
Hello viewers, Assalamu alaikum. I think you all are fine. This is Dr. Shahadad Hossain. So today we'll talk about neck pain, and a brother from Canada. He was suffering for neck pain for a long time, and he has got treatment of neck pain. So let's talk with him.
Assalamu alaikum. My name is Ahsan Habib. I'm from Canada. I'm 37 years old. In Canada, I work as a nurse in Centre Hospitalier Université de Montréal, which is a French university health center. I work in the operation theater and sometimes in the recovery room, which asked me in the operation theater to stay with the surgeon for around 4 hours standing, as working internal and external. Uh, I think 2020 on December 11th, I had an accident while going with a patient in ICU. I hit a wall on my spine, which in 3 seconds, I felt like numbness in my toes. And then it left. I finished my duty 30 minutes after I went home. I felt fever, headache, pain all over my body. I thought it was COVID. It's normal. Like COVID, you take flu shots, you think it's okay, it's gonna go away. On Monday, I just couldn't move anymore. And then I called my work. They told me, uh, that's you have to come to work. So what can I do? I work in an operation theater. I have to come. I have my duty. I work. I was on call also. And next day, when I came, my head chef, he said go home. I went home, and then since that day, I don't work. And we have here, there it's called Centre Sécurité de Travail Employé. It's for the organization, for them to give me care. Then I went to a physiotherapist there, and the physiotherapist, what they used to do, they used to just look your CT scan or your MRI, and they used to say just this is your problem, this is where the effect is, the symptoms are, and they will just treat that. So they've been doing that for 1 whole year. They've done. I went back to work again, and then after going back to work one day, the symptoms started again. My brother told me there's a doctor in Bangladesh. Okay, his name Dr. Shahadat Hussain, and like I asked my doctors there, doctors and the physiotherapists, and what they asked me, why would you want to go to Bangladesh? People from out of the country, they come to US, America, UK, they study there and they become higher doctor. Like even here in Bangladesh, you see like in the chamber, you say they finished their studies in US. They're big doctors. So I was afraid, of coming to Bangladesh because, I don't know, due to people saying, their reviews, stuff like that. But as I came to Bangladesh, my brother told me what? He told me, it's your life. You're the one who takes, you're responsible for your own life. You're responsible for your kids. During the accident, I was affected what? My financially, relationship, especially when you can't even, I had a newborn, 2 years old. I couldn't even take, 2 months. I couldn't even take him in my arm. I couldn't even take 2 kilos in my hand. So it was like, especially in the relationship, that affected me a lot. And Alhamdulillah, my wife, she was there to support me. Um, then after, I said, you know what, let me see. My brother came this year after 2 years. 2 years I did take all the treatments. Now after I came 2 years after, here I see I went to the office and my brother brought me here and I met the doctor. And Alhamdulillah, I would say like to a person who's suffering, for him, it feels like a torture. But my accident were what? It was in the spine, in the cervical, in the dorsal, in the lumbar. So the three region. But the doctor there, they only worked one parts by one parts. But they didn't go look the all of the parts in the whole body. Here, when I came, doctor, they had this program called SDM. They check the structure, they do the assessment, and after they do assessment, they diagnose what's the problem. Then they also manages the problems like in related to that, what other problem could you have? So he asked me many questions. Alhamdulillah, I mean, I myself sometimes see myself in the mirror, but he's someone has to see you in front, to be able to assess you properly. He said my my shoulder were inclined, and he worked on that so hard. Okay, Alhamdulillah, I feel like I don't. And doctor used to say you need to be like commando, like in the army, you have to walk like that, Like now, Alhamdulillah, I'm relaxed. On my neck, they've been working. I've been here for what now, 7 days, 3 time therapies, you know, and more. I will say Alhamdulillah, 70%, 70%, Alhamdulillah. Surely, if it was 100% would be better. Doctor asked me for 10 more days. Just now, the problem is with the floods, with the what do you call it, strike in the country. So now I have to go. I have to go back to Canada, and that's why like I wish surely I will try to come back, but I had to go. That's why I'm leaving. Inshallah, inshallah. But still, even though I'm going, okay, he has given me the exercises because exercise, whatever exercise that I have done, whatever they have done, manipulation, trying to treat me and stuff like that, it's all about you. It's you have to take care of yourself. You have to continue to do all the exercise. You can't stop because my doctor there, they told me you have to change career, you have to change your way of life. Yes, you have to change your way of life because it's a continuous work, So he'll give me the exercise, and inshallah, I'll do all the exercise. I'll stay motivated, Jazakallah khairan. Assalamu alaikum.
Basically, he has problem in the neck, dorsal spine, and so lumbar spine. We follow our SDM form, structural diagnosis and management. Already he mentioned. This is the technique of manual therapy. Especially is the during the assessment we follow the exactly what's maybe the reason. As a reason means where the exactly problem is, how much association with the other structure of the body. But we hope and pray for you that you will be a good life in Canada, inshallah, with your
Inshallah.
family, with your professional life. Thank you so much,